Hello and welcome. Navigating cancer care can be, well, it can be a lot. And just trying to find solid, reliable information is such a huge first step. So in this explainer, that's exactly what we're going to do. We are breaking down the science behind a very specific nutritional supplement that's been studied for its potential role in supporting patients during their treatment. So let's just get right to the big question, right? Can a food supplement actually support conventional treatments like chemotherapy? Today, we're going to look specifically at the clinical evidence behind one compound called fermented wheat germ extract.
So yeah, the compound is fermented wheat germ extract, or FWGE for short. And right out of the gate, it is so important to be clear about its role. This has been studied as a supportive therapy, sometimes called an adjuvant therapy. What does that mean? It means it's designed to be used alongside conventional medical treatment, never as a replacement.
What we're talking about here is something called a functional food, and you can just think of it as a food product that offers some health benefits that go beyond just basic nutrition. So the research we're diving into today is really looking at how this specific functional food could be brought into a bigger oncology program to potentially, improve outcomes. Okay, so what does the evidence actually show? Because at the end of the day, that's what really matters. Let's take a look at the actual clinical trial results for the specific kinds of cancer where FWG has been studied the most. So the first area where the research is pretty compelling is in colorectal cancer. This has actually been a major focus for a number of studies, all looking at how FWG can support patients as they go through their treatment. And what's really interesting is the language the researchers themselves used. They actually described the results as striking. For patients with colorectal cancer, adding FWGE was linked with a lower risk of the cancer coming back or getting worse. I mean, that is a really big deal. And the research doesn't stop with colorectal cancer. There have also been studies exploring its use in patients with melanoma and prostate cancer, especially in cases where the disease has gotten more advanced and a lot tougher to treat. Now, this context is absolutely key. See, in a lot of these studies, FWGE was brought in as that supportive or adjuvant therapy for patients who had advanced cancers and weren't responding so well to their first treatments. The idea was to see if it could help, bolster a treatment plan that was starting to struggle. So just to kind of pull it all together, for colorectal cancer, they saw benefits across all stages. For melanoma and prostate cancer, the evidence really points to its role as a supportive therapy, especially for patients in those more advanced stages. And that distinction really helps clarify where it might be most helpful. Okay, so this all sounds pretty promising, but the next obvious question is, how? How does it actually work? What's going on inside the body? Well, the science points to this concept called immunomodulation. It sounds complicated, but let's break it down. At its core, an immune modulatory compound is just something that helps bring balance back to the immune system. So it's not about just boosting it like crazy, it's more about helping it function smarter and more effectively, especially when a disease has thrown it all out of whack. Researchers think FWGE works with a kind of 1-2 punch. First, like we just said, it helps get the immune system back in balance. And second, it seems to help reduce inflammation in the gut and improve the microbiome, which, as we're learning more and more, is just incredibly important for our overall health. So how does it rebalance the immune system? Well, one of the main ways is by messing up a little trick that cancer cells use to hide. See, they cover themselves in certain proteins that act like a disguise, making them basically invisible to your immune system's defenders. FWG seems to help strip away that disguise, effectively unmasking the cancer cells so your immune system can finally see them and attack them. But the potential impact here isn't just about the cancer cells themselves. Honestly, one of the most compelling parts of this research is how FWGE might affect a patient's quality of life while they're going through treatment. So, we all know standard treatments can save lives, but they can also come with these awful side effects, right? The fatigue, the nausea. Research suggests that FWGE might actually help reduce some of these side effects, and that is not a small thing. For some people, that can be the difference between being able to get through a full treatment cycle or not. I mean, just think about that for a second. Instead of a supplement that comes with its own long list of side effects, the evidence suggests FWGE might actually reduce the side effects from the cancer drugs themselves. For anyone who has been through treatment or watched somebody they love go through it, you know just how huge that is. All right, so we've covered the what, the why, and the how. Now let's tie it all together with some really important takeaways and practical next steps if you're thinking about looking into this more. So, here are the key things to keep in mind. First off, quality really matters. The research is focused on specific verified brands. Second, it's always important to remember that more independent research is always a good thing. Third, and this is a big one because it might affect estrogen, a doctor's input is absolutely essential for anyone with a hormone-sensitive cancer. And last, but most importantly, remember, this is studied as a potential add-on to your medical care, never ever a substitute for it. And that right there, that really gets to the whole point of this. This is about information. It's about empowerment. The goal is to give you the research so you can have a more active, more engaged conversation with your medical team about all of the options out there. So let me just end on this really crucial point. Nothing we've talked about today is medical advice. This is a resource, a way to connect you with the research. The real power of this information is using it to start a good, thoughtful, informed conversation with your doctor. Thanks for tuning in.